So moving on to the next speaker, he will share stories of similar struggles from the healthcare front lines, both pre and during COVID. And Dr. Richard Huynh is a son to Vietnamese immigrants. He was born and raised in Southern California. He now lives and practices pulmonary and critical care medicine in the South Bay, where he was recently and newly elected as a California Democratic Party Assembly District Delegate. So Dr. Huynh.
Thank you so much, Sheng-Sim, for the introduction, and thank you and all of the organizers for this incredible event. Just amazing speakers to start off with Taiji and a great overview, and Keshi, Chancey, and David sharing such stories, and of course, Assembly members Ash Kaura, Miguel Santiago, and Alex Lee for pushing AB 1400. This has been amazing, and I'm really excited to see the rest of the speakers, Carmen Kamsi and Dr. Paul Song. I'm just humbled to be a part of this, especially as I am admittedly very new to the space and a newly elected CDP delegate. But I think what I can offer is a unique perspective as a son of Vietnamese immigrants, as a physician, and as a patient advocate. What I can offer are my stories and my experiences. I want to tell you about a man I recently met. He was a young man, Samoan, beautiful family. He had caught COVID sometime last year and had a horrible course. He was in the ICU. He was on a breathing machine for quite some time, but he had survived. He made it. He made it home. But he had developed some scar tissue in his windpipe, and it caused it to be narrow. And so even after he left the hospital, he had a lot of difficulty breathing. Imagine you're breathing through a straw. To make matters worse, he didn't have very good insurance. He bounced around trying to find help. Ultimately, he found a doctor that was in his network, but was hours away. And even though that doctor did what they could, they were limited as to what they can do. They told him he had to go to a more specialized tertiary center. And so the doctor put in a referral for him to go. But that referral needed insurance approval. So delay. And during that time, his breathing got worse and worse. He ended up in the emergency room. Once he got to the emergency room, the doctors there said, yeah, this is really bad. We need to get you to a tertiary center. And so the ER doctor and the specialist at the hospital that he was at referred him to the tertiary center, sent in all the paperwork. Well, guess who got in the way again? The insurance companies. They said transfer needed authorization. So while he waited for his transfer, his windpipe completely closed up and he was unable to breathe anymore. He had to be intubated, or a breathing tube had to be placed into him, and he nearly died. Think about it. This man had survived COVID. He had beat COVID, but the system nearly killed him. The thing of it is these stories are not COVID specific. These stories, these problems of our system is not something that COVID created. This pandemic had only amplified this glaring problem that we have. A few years ago, I remember meeting a Vietnamese man. He's about the age of my dad. He had insurance, good insurance, right? Quote unquote, HMO. He had saved up money and paid for it. He came into the hospital with a cough, and the hospitalist asked me to come see him because I spoke Vietnamese. Now, my Vietnamese is not very good, but I get by, and he was quite happy to see a familiar face, I guess, and hear someone who speaks his language. He said, "Có người bác sĩ rằng tiếng Việt hơn quá," or translated, "I have a Vietnamese speaking doctor. I'm so lucky." Well, unfortunately, he wasn't that lucky. He had a mass in his lung and he needed a biopsy. To make matters worse, he had an insurance company that wouldn't approve him to have that biopsy as a hospitalized patient. They said that he would have to leave the hospital, get referred to a specialist, and then get authorized for the biopsy. Delay. Well, unfortunately, also his insurance company wasn't contracted with my office, so I had to talk him through each step, where he had to go, etc. I even gave him my cell phone number just in case he had any troubles. A few months later, I met him again, my Vietnamese friend. His cancer had progressed. Between his communication issues with the various offices that he had been run around to, he'd missed a couple of appointments. His insurance company took their time approving of the biopsy. They sent him to an oncologist 45 minutes away who also didn't speak any Vietnamese. During all that time, his cancer had progressed and had spread. I remember coming and visiting him at the hospital, and the first thing he did was he apologized. He said that he was sorry that he didn't call me, but he just didn't want to bother. But he told me, Dala Ijai, that's heaven's way. That's not the way it should be. That's not the way it needs to be. You see, the thing is that we, patients, healthcare workers, we've normalized these stories. We've normalized that this is just the way our health system works. But the fact is this is not normal. Better is out there, and we deserve better. If we had a single payer system like CalCare, AB 1400, our Samoan friend would have been stabilized and immediately transferred. No need for insurance authorization. Actually, if we had a single payer system like CalCare, AB 1400, he'd already been at the specialist center because he had gotten a referral from his doctor. He would have gotten that even earlier if we had had a single payer system like CalCare, AB 1400, because he wouldn't have had to be bounced around looking for different physicians. He wouldn't have to see a doctor hours away. If we had a single payer system, CalCare, AB 1400, my Vietnamese friend would have gotten his biopsy as a hospitalized patient. If we had CalCare, he would have been able to see me or any other Vietnamese speaking doctor. There would be no communication issues. If we had a single payer system like CalCare, he would still be with us. I have countless stories like this. I've never had to tell the same story twice. You can ask anyone who's watched me or listened to me speak about these things. These stories are the stories of my life. These are the stories I deal with on a daily basis. These are the stories of all healthcare workers. And these are the stories of our neighbors, our loved ones, and our community. We need to put an end to these stories because we do deserve better. We deserve a single-payer healthcare system that promotes multicultural health equity. And that healthcare system is AB 1400 CalCare. That's what we deserve. Thank you all.
Thank you, Dr. Huynh. Thank you for sharing these such painful stories.